There are new fears in this country about the potential impact of the H5N1 bird flu on humans. After it first jumped to dairy cows back in March, the virus has now spread among dairy cattle across 9 different states. A Texas dairy worker developed mild symptoms of the disease. We're happy to say they've recovered. Our chief medical correspondent, that's Dr. Jon LaPook, has been speaking with the experts and joins us now. Jon, a lot of people getting worried, so glad you're here.
Good morning, Gail. Public health officials are closely monitoring for any signs H5N1 is mutating into a form that could spread from human to human. There's no evidence that has happened yet, but that's the big concern. The outbreak has raised questions about our ability to do enough testing to understand how widely the infection is spreading. And keep in mind, it's tough to coordinate efforts with so many groups involved, including the CDC, the FDA, dairy and cattle industry, and more. So why the concern about a possible jump to humans? I spoke to one of the top bird flu experts, Dr. Jerry Parker, a veterinarian at Texas A&M. And he told me he never envisioned a scenario where the virus would make the jump to cows.
That was something nobody imagined?
I didn't. I have to admit that. And I don't think our colleagues at the national state level did, and they should have. We fundamentally did not have a response plan and playbook for how to deal with H5N1 getting into dairy cattle. And I think that's slowed our response and has caused confusion.
One big fear is that a pig or some other animal could become infected with both the human and bird flu, and that could cause a mixing of genes that produces a new virus capable of spreading easily from human to human. Epidemiologist Dr. Larry Brilliant has worked in public health since helping to eradicate smallpox in the 1970s. I asked him, is there enough testing going on to find out how widely bird flu has already spread?
No, they should activate every surveillance system that would help them find out which animals are sick. They should use wastewater. They should be checking the water in bilges of ships and bilges of airplanes. And here's a good reason to do it. We have antivirals. We have treatments. We can make a vaccine very quickly.
Well, Jon, nothing we just heard there is very comforting to me. What's being done to increase the testing?
You know, it turns out that poultry farmers are reimbursed for financial loss related to bird flu. There's an insurance policy. That's not true with cattle ranchers. And in addition to that, there are a variety of reasons why people working there, various workers, may not want to get tested. So I've heard that the USDA and the CDC are working on a plan to incentivize more testing.
So how worried should we be right now?
Right now is the key word. You know, last night, the CDC told me, and they gave me the latest, unless you're in close contact with potentially infected animals or you're drinking unpasteurized milk, the risk to you right now is very low. But remember, things can change. We've learned, unfortunately, from the pandemic. I know this pandemic
can change quickly.
They can, especially with viruses.
Emphasis
they can mutate
right now.
They can now. They can mutate. They can change. We've seen that happen, and that is why there's such concern among public health officials and others, and why the CDC and others are really trying to stay on top of this.
Yeah, because first it was just 1, and now it's moved to 9 states, and it just seems like it can turn on a dime.
But only
so I'm wondering, at what
person.
point do you get worried? You're saying, don't worry.
I'll tell you. I'll tell you what. The worry would be if it changes in mutations, genetic composition, so that it can spread easily from human to human.
Right now, there's been no evidence
of that. If it's no evidence of that, there's one human got a relatively mild infection. He had conjunctivitis. He was given Tamiflu. He recovered. But that's what people are looking for. And we don't want it to happen without us realizing. You know, if you do this, you don't know what's going on. You got to do this and say, what is going on? Where is it? How widely is it spread?
Well, Dr. Jon LaPook, we love having you because you're making our fears go away. Thank you so much.